Today's topic is asthma. Asthma is a chronic disease involving the airways in the lungs. These airways or bronchial tubes allow air to come in and out of the lungs. If you are suffering from asthma, your airways are always inflamed. They become even more swollen and the muscles around the airways can tighten. When something triggers your symptoms, this makes it difficult for air to move in and out of the lungs. Causes of asthma is a chronic condition in which the airways that carry air to the lungs are inflamed and narrowed. These inflamed airways are very sensitive and they tend to react to things in the environment called triggers, such as substances that are inhaled. When the airways react, they swell and narrow even more and also produce extra mucus. This all of which make it harder for air to flow to the lungs. The muscles around the airways also tighten, which further restricts airflow. Asthma triggers are different from person to person and can include such as airborne substances such as pollen, dust mites, pet dander, particles of cockroach waste, mold spores, respiratory infections such as common cold, physical activity, cold air, air pollutants, and irritants such as smoke, and certain medications including beta blockers, aspirin, ibuprofen, strong emotions, and stress. Let's move on to the signs and symptoms. Early warning of sign of asthma include frequent cough, especially at night, losing your breath easily or shortness of the breath, dyspnea, when exercising, feeling very tired or weak, wheezing or coughing after exercise. Patient may feel tired, easily upset, and becomes moody. Decreases or changes in lung function as measured on a peak flow meter. Signs of cold or allergies like sneezing, running nose, cough, nasal congestion, sore throat, and headache. Trouble sleeping. Other symptoms may include severe wheezing when breathing in and out, coughing that won't stop, that is frequently coughing, increased breathing like rapid breathing, chest pain or pressure, feeling of anxiety or panic, pale sweaty face, blue lips or fingernails are also signs for asthma. Coming to the diagnosis part, doctor may ask you questions about your signs and symptoms and any other health problems during physical examination. Few tests are recommended to measure the lung function. You may also be given a lung function test to determine how much air moves in and out as you breathe. These tests may include spirometry. This test estimates the narrowing of your bronchial tubes by checking how much air you can exhale after a deep breath and how fast you can breathe out. Next is lung function test often are done before and after taking a medication called bronchodilator to open your airways. If your lung function improves with use of bronchodilator, it's likely you have asthma. A chest x-ray and high-resolution CT scan of your lungs and nose sinuses can identify any structural abnormalities or diseases such as infection that can cause or aggravate breathing problems. Allergy test can also be recommended, which helps in identifying allergy to pets, dust, mold, pollen. Coming to treatment usually involves learning to recognize your triggers, taking steps to avoid them. In case of an asthma flare-up, you may need to use a quick relief inhaler. Preventive long-term control medications reduce the inflammation in your airways that leads to symptoms. Homeopathic treatment for asthma involves the use of largely diluted substances deduced from nature, aiming to stimulate the body's self-recovery mechanism. It's important to note that while some people find relief with homeopathic remedies, these shouldn't be replace conventional medical treatments. Here are a few points that generally use homeopathic remedies for asthma. The first is arsenic album. This remedy is frequently recommended for people with asthma who witness anxiety and restlessness along with respiratory symptoms. The next is tuberculinum is a homeopathic remedy deduced from the tuberculosis bacillus and is considered for individuals with a history of tuberculosis or a tubercular miasm. In homeopathy, miasm refers to an inherent inclination to a certain illness. Natrum sulfuricum. Individuals who develop asthma symptoms in damp or sticky conditions may profit from natrum sulfuricum. It is also indicated that asthma is activated by exposure to the fungus or living in a damp surrounding. Antimonium tarticum. Antimonium tartaricum is generally known as antitar, is a homeopathic remedy reduced from a mixture of antimony and potassium tartrate. It is considered for individuals facing asthma symptoms characterized by rattling cough, extreme mucus production, and difficulty breathing. The next is Spongia tosta is useful for asthma with dry barking, cough, and gasping. Symptoms may worsen at night and ease with warm. Thank you for watching my video. Please do not forget to like, share, and subscribe to my channel and hit the bell icon to stay updated on my latest videos. Thank you.